Hi, everyone. This is Nicole Jorwic, the Senior Director of Public Policy for the ARC of the United States, here with a bit of an update from Washington, D.C. as we head into the Memorial Day weekend. As I discussed last week, the House of Representatives did pass at the end of last week the HEROES Act. That includes, it's a large package, over $3 trillion. It includes a lot of things that I talked about last week for state and local government relief. And, we're continuing the push to make sure that the provisions of the HEROES Act that I'm going to go through as negotiations go on in the Senate, that they stay in. People with disabilities and older adults we know are particularly at risk as COVID-19 continues to spread. There's a high risk for complications and death if exposed to the outbreak, and obviously a need to protect themselves. And so we need to make sure that there's funding for home and community-based services that I'm going to go through, and also there is support for the programs that people rely on. We're pleased to see that the HEROES Act included a global FMAP increase for Medicaid, or a federal match, so additional funding going into the Medicaid program. I talked about that last week. And that will be really important to continue to support the program and the broad needs of the program for healthcare. When states face budget crises, we know, we actually just saw this week from California that when states face these crises, unfortunately, Medicaid is a place in human services, a place where cuts are found. Global FMAP will support the stability of the program, but again, we still require those dedicated funding streams for Medicaid, home, and community-based services. We must continue to urge that the package is negotiated as it's being negotiated in the Senate, that includes those dedicated funding streams for Medicaid, home, and community-based services. The HEROES Act included a targeted 10% federal match, so FMAP, to increase for home and community-based services, and those targeted funds are desperately needed. Whether it's an FMAP, whether it's a grant program, the fact of the matter is we need that dedicated funding stream for home and community-based services. That funding would support the provision of home and community-based services for people that are eligible for Medicaid and also who are currently receiving services. So it would include people on waiting lists. The funds can also be used to support recruitment and retention of the essential direct support professional workforce, and to transition people back to their homes if they do have to be hospitalized due to COVID-19. Global FMAP funds, while important, do not go directly to supporting the vitally important HCBS program, and so we really need to make sure that as the Senate is negotiating that they continue to hear from constituents about why these funds and why these programs are so important. The other important, there's many other important provisions, and those include expanding the economic stimulus payments to adult dependents and issues of another round of payments, including everyone, and removing barriers for people who are not, and people are not going to still be required to file tax returns. So we've worked out a lot of those kinks, led by my colleague Bethany Lilly. It also led by Bethany, expanded paid leave to the same leave provisions as were included in the first packages for paid sick. And so that includes siblings of people with disabilities, as well as grandparents who might be taking care of grandchildren with disabilities. It includes $850 million in child and adult disability care, which is called family care, funding for essential personnel, including direct support professionals. So, and there's also provisions that would provide hazard pay and overtime for the essential workforce. There are provisions that codify the requirement that state Medicaid programs cover non-emergency medical transportation, or NEMT. That was already required, but the law codifies it, and so now states won't be able to wiggle out their responsibilities to provide that very necessary funding for non-emergency medical transportation for people with disabilities to be included in their communities. It also included additional funding for housing and education, a 15% increase in SNAP benefits for food and nutrition. And so there is a lot of provisions in there. The number one ask obviously continues to be the dedicated funding stream for home and community-based services. At the end of this week, both the House and the Senate will be on recess. The House will return most likely after Memorial Day, but the Senate, which is the focus, because again, that's where the negotiations are going to be happening, they're going to be home at least until Monday, June 1st. So they're going to be home in state while face-to-face interactions and while social distancing needs to remain. There are a lot of ways that you should be reaching out to your senators, their offices, seeing if they're having virtual town halls, seeing if there's ways that you can connect and ensure that they're hearing from their constituents about why the disability community is essential, why the direct support professional workforce is essential, and why we need those dedicated funding streams for home and community-based services, the expanded definition of caregivers, and making sure that stimulus payments are available to everyone. I want to thank you for your continued advocacy. It's a huge thing that so many important provisions were included in the bill, and now we need to make sure that they stay in as it gets over the finish line. Thank you again, and I hope you have a healthy and happy Memorial Day weekend.